KEX.
I know there will be a lot of discussion today about the politics of all this, about who won and who lost. That's how these things tend to be viewed here in Washington. But that discussion completely misses the point. Whatever the politics, today's decision was a victory for people all over this country.
President Obama very pleased that the Supreme Court saw things his way, and most members of Oregon's congressional delegation are hailing the Supreme Court's health care ruling. But the Republican Congressman, Greg Walden, representing Oregon's 2nd Congressional District, says the law has to be repealed. And let's ask him why. He joins us live from Washington this morning. Good morning, Congressman Walden. Why do you think the health care law simply has to go?
Well, for a couple of reasons. First of all, it does not bring down the cost of access to health insurance. We have reports that show it's actually going to go up, not down. Second, it's a massive tax increase on average Americans. This new penalty is not a penalty; it's a tax increase, and in fact, it's not one but 20 tax increases, of which $316 billion falls on the middle class, and that's not right or fair. Third, it's not patient-centered. You know, you can have a panel of unelected bureaucrats, 15 of them, working in Washington, making decisions about what gets covered, what not, at what rate. This is going to choke off access to coverage.
Some on the right believe as the Affordable Care Act is implemented over the next few years, it's going to have a very negative impact on businesses and the people who work for businesses, large and small. Some even say companies are going to take away the health care plans for their employees. Do you see that happening?
Hey, if the companies don't, the government will, because if there's any change in the policy, you don't get to keep the plan you have. And most policies change anyway. And so what you're going to have here is a situation where, and I was a small employer, we paid 100% of the premium for the people who worked for us. So I've been through these battles for 20 years as a small employer. I always wanted the ability to negotiate and get the rates down. But as a small employer, I didn't have that. You don't have this here either. But what you do have is the ability now to say, okay, folks, you're out on your own. Go into the exchanges. I'll pay the penalty. It's less than what I'm paying today for the insurance. And I'll have money ahead. And, oh, by the way, I don't have to mess with any of this anymore. And then there's another phase. Once you trip over a certain number of employees, I believe it's 50, then you're subject to a lot of these mandates and penalties. So if you're right at 48, 49 employees, are you going to go over that 50 threshold or not? I think it's now employers know the game. They know their costs, and I think it's going to have a dampening effect on the economy.
It seems most people do like parts of this law, such as not being able to not deny somebody health insurance because of a pre-existing condition, and adults can keep their kids on their health plans up to age 25. Legislators on the left and the right say those components are probably here to stay. Do you agree?
Not only are they here to stay, they should stay, as should the removal of the lifetime caps. Those were things we had common ground on.
On the state level, the governor plans to transform Oregon's health care system under this Affordable Care Act. How do you see this impacting the health care of Oregonians?
Well, it's an interesting concept, the CCO concept. It sounds a lot like the old HMOs or managed care organizations, health maintenance organizations. It has the possibility of bringing the various providers together and reducing costs, but it, again, is a big experiment with a $1.9 billion advance from the federal government now over a multi-year period to see if doing this reduces costs at the end. But states are a place where you can have a laboratory. Hopefully, Oregon, who's always been progressive in this area, can find a way to lower costs and increase access to care. So if they want to do that, fine. But I hope they really have accountability and transparency in the process, and we don't end up just back to where we were with the Oregon Health Plan, which became a giant fee-for-service Medicaid expansion that the state's having trouble affording.
Bottom line, you and other Republicans say it's your goal to repeal Obamacare. What would you have to do to get that law repealed?
Well, not only repeal, but replace with sensible market-based approach to health care that actually would lower the costs and make it patient-centered. You'd have to have a vote in the House. You'd have to have a vote in the Senate, and the president that would sign the repeal. That's what elections are about. We'll know in November if that's going to happen.
We will leave it there for now. Congressman Greg Walden, thank you for spending time with us this morning. Appreciate it.
You're welcome.